The number of lupus cases in Trinidad and Tobago is at an all-time high. That is, according to Reeanna Harrilal, founder of the organization Voice of Lupus. Though the Central Statistical Office and the Ministry of Health have not been keeping abreast of the figures, Harrilal tells us the organization has been recording the number of lupus patients.
Based on the fact that we've been around as a non-profit organization working with lupus patients, we have collected over 4,000 plus names of patients, and their age groups vary. We find there's a trend that more and more there are younger persons being diagnosed as early as in, there's something called neonatal lupus, which affects newborn babies. Then there are kids, I'm talking about 9, 10, 11, their kidneys are going and they have to do dialysis and stuff like that.
Systemic lupus is a chronic and presently incurable disease of the immune system, a condition in which the body's defense mechanism begins to attack itself through an excess of antibodies in the bloodstream, causing inflammation and damage in the joints, muscles, and other organs. According to Harrilal, the number of lupus cases in the country could be much higher, but many cases remain undiagnosed due to the common symptoms of the disease, such as joint pain, fatigue, indigestion, and rashes. A lupus survivor herself, Reeanna Harrilal founded the Voice of Lupus back in 2011 to use her experience of living with this debilitating disease to help others with their struggle. Surveys in the UK suggest that the prevalence of lupus is highest among the Caucasian women and the Indian Afro-Caribbean women. She believes the time has come for the government to recognize the urgency of lupus.
Awareness just does not come about by just one person just bumping their gum. It takes a collaborative effort, and I really truly wished that the Ministry of Health, even the Ministry of Social Development, they take a first-hand approach in getting to learn more about lupus themselves and also partnering with us so that we can get the message to more people. Thank God we've been able to do something in the last 5-6 years. But could you imagine if we had the support of corporate society? Could you imagine if we had the support of the government?
As if a lack of awareness on the disease isn't enough to stifle the lupus community, Reeanna Harrilal also noted that there is a lack of proper medical infrastructure to help them.
In this country, and I think I'm trying to change that, because I have a vision, but that vision can only go so much if I don't have action, and it's to change the system, the way health is dealt with, not health for people. I'm talking about my lupus patient. There isn't even a lupus clinic. There isn't a lupus ward. The way they treat lupus here is still like 20 years ago. There's so many other things going on in first world countries in terms of their options. The last option in treating lupus abroad is steroids. Here it's the first.
Her hopes on changing the way the lupus community is recognized was first shattered when she approached then Minister of Health, Dr. Fouad Khan.
I have met Dr. Fouad Khan in person, handed him my proposal, explained to him what's going on, what needs to be done, and nothing happened. And that's when he was the health minister at the time.
A message for the rest of the country?
In order to say NO to lupus, we must be able to KNOW, no lupus. You have to know it before you can come together and give it one voice and say no to it.
Bhavita Gopalchan, Win Caribbean News.